Hi everyone, Dr. Remy from Pain Free and Fit. Today, a great core workout for your lower back pain and self-rehab, cliffhangers. Hope you enjoy them. Cliffhangers are a great core exercise to develop the direction-specific core stability of preventing hip hiking, which is elevating one side of your hip or pelvis up more than another. If you have back pain that's provoked with raising your hip upwards, whether you're standing or sitting, this is a great exercise. Let's get into exactly how you do it. The cliffhanger is performed lying sideways on a bench with your hip towards the end of the bench and your legs hanging off, and the side that you typically hip hike on being the upward side. In this position, you can hold onto the bench initially for a little support to help balance, and you're going to engage your core muscles, including your multifidus, transverse abdominis. If you don't know how to do that, we have other videos on the channel that explain it, and correct any anterior or posterior pelvic tilting positions that you need for your back pain. In this position, you'll simply make tiny micro motions, about 1 inch, with your legs pumping up and down. As you do this, you're going to maintain that top hip down so it doesn't move up, allowing the motion to come from the ball and socket of your hip joints, but not swinging your entire pelvis up. Once you have your balance, you can use your hand on the top of your pelvic bone to monitor that it's not moving up and down as your hip abductors and adductors are working, as well as abdominal and back muscles to hold your body in this position. At the beginning, you'll perform 20 to 50 repetitions, and after a while, you'll build up by adding 5 to 10 per workout, twice a week, until you get to several hundred reps. This will develop your ability to move the legs in abduction and adduction and other core muscles without the tendency to hike your hip up and disturb lower back pain. As you advance in your cliffhanger exercise, you can use additionally resistance bands wrapped around the ankle for further resistance, or hold a light dumbbell between your ankles while performing the exercise, or enlist the help of a training partner who can give you a slight hand resistance against your ankles to help you with your progress. Remember, once you complete your reps and sets on the side that you hip hike on being up first, you'll want to turn over and perform the same exercise on the other side to develop the abdominal and back muscles that resist your hip hiking tendency. So plug this exercise into your own self-rehab back pain program and let me know how you make out. Remember, your best results will always come from choosing exercises that target your specific direction of low back instability and the directions of movement or posture that provoke your pain. Subscribe to the channel. We got a lot of great videos out there to help you with your back and training injuries. Give me a thumbs up to share this valuable information with others. And remember, if you're looking for a great way to build your own self-rehab program with the help of a body analysis concerning your muscle imbalances, core weaknesses, posture and movement tendencies, and figure out a systemized approach to slowly and gradually build your way back up into handling heavy weights and physical activities without hurting yourself, check out our many programs for back pain relief at painfreeandfit.com.